name is Cheryl Lewin. I'm a Microtia surgeon, and I use the porous implant ear reconstruction technique, which is called PEER, as we refer to it. And I want to welcome everybody to our first live question and answer. This is our first time doing this. It's very casual. We really appreciate everybody that sent us questions. We picked several of them, maybe not every single one, but we picked a bunch to go through. So we hope you learn a little bit from this session. By the way, if you're joining us live, you can go ahead and type in questions, and if we have time at the end, we'll go ahead and answer those as well. So otherwise, you can just submit questions to info@lewinmd.com. So I'm just going to get started. Our first set of questions comes from, forgive me if I'm pronouncing this wrong, Ji Han from Canada. And the first question is, how many surgeries are needed for a bilateral child? Do you do both ears at one time or separately? So PEER reconstruction is technically a little bit of a complicated operation, and it takes a long time. So it's an all-day thing. So we do one ear at a time. And for a bilateral child, let's say we did the first ear in January, you can do the second ear 3 months later. And if there happened to be a need for a revisional surgery after the 2 primary reconstructions, you could do that 6 months later. What is the best age to have surgery, and when should we schedule the surgery with you? So I always tell families there's no best age because it's very dependent on, you know, everybody's family situation and the individual child. Yes, we can do surgery as early as 3 years of age, but that's not necessarily a best age. But I will let you in on a little bit of a surgeon's bias, because there is an age where the anatomy is just incredibly perfect from the surgeon's perspective. It's good many different ages, but when you are 4 years of age, it tends to be incredibly beautiful anatomy and tiny, tiny blood vessels that don't bleed at all, so it's almost bloodless. But the anatomy is big enough that I can get the right size flap and everything. So I tend to like 4, but again, 3, 4, 5, there's no great difference. And older is also good. When should we schedule surgery with you? We will allow patients to book out 1 year in advance. So if you knew you wanted surgery a certain month of a certain year, you contact us 1 year prior and we will book that surgery for you. There's always some shifting in the schedule, so recommended to do it 6 months in advance if you really are specific on the date that you want. If it's sooner than 6 months, we'll do our best to squish you in wherever we can. Can a Medpor or support ear last a lifetime? And if years later a new and better material comes out, can it be replaced? I actually think this is a fantastic question, because there's a concept in the answer of this question that I don't think is well understood. So since the first Medpor surgery, which is Medpor and Supor are similar materials, porous polyethylene implants, that first surgery was done in 1991. So we know, that length of time since 1991, so 26 odd years, we see that these have lasted. The material is very well tolerated by the body. The body actually integrates into this material, and that's not a theory. That's proven that there's tissue integration. So we believe that it would last a lifetime, but since there's a limit to how long we've been using it, we don't really have the exact answer. But I think the more important part of that question, let's say there's something better that comes along. Well, I have discussed with several companies and people working on pushing and advancing Microtia research, and there will likely be at some point a better implant perhaps, but the process of how that implant will be used, it's my belief that it is almost certainly going to require the exact same technique that I'm using today, which is, taking the implant that's the framework for the ear, using what we call fascia or a flap, which is tissue that lives under your scalp here, under your hair follicles, but on top of your bone, and you basically wrap that flap around the implant. The way that I do this surgery, that wrapping is done in such a way that it can be unwrapped and preserve the tissue flap and all the skin grafts. that material is the patient's and forever is going to belong to that patient. And so what's so great is you can just, with no new scar, no new graft, no new flap, you can just unwrap that tissue, take out the old implant, put in the new, and cover it up. One question later, I think, was about what if something happens? It's the same way we would replace a framework if something happens. We'll get back to that. Oh, it was here. If the implant breaks, can it be repaired? Yes, it can be. I have an extremely low fracture rate. Since January 1 on my stats that I keep every 6-month increments, since the 2013, I've only had, I believe, 1 or 2 implants that have fractured. That's in several years. So I believe it's because of the way I make the implant that has made it much stronger. This question comes from Judy. Do you prefer families get the Baha abutment surgery before or after Microtia surgery? So for those of you who don't know what that question refers to, Baha, or sometimes referred to as BAHS, B-A-H-S, stands for Bone Anchored Hearing Aid or Bone Anchored Hearing System. And that is a bone conduction processor that can be worn on a soft band when you're a baby up to the age of 5. And then after the age of 5 can be used as a surgical procedure with essentially a snap or in some cases a magnet, and the processor clicks on to help children with Microtia atresia hear. So I do have a strong preference that this is done either at the same time that I'm doing the ear. I can do the Baha or BAHS for the patient, or 3 months after, or any time after that. The reason I don't want it done before, it's not impossible. I can work with it and have had to do that before, but when you go in to do the drilling for this Baha or BAHS system, you can't see where there's blood vessels. You just drill this small hole in, but if it happened to injure a blood vessel that I would find important for the flap, I would prefer not to have to deal with having the flap have less of a blood supply. From Geo, when do you perform Baha surgery? FDA guidelines tell us in the United States that you have to be 5 years or older, for insurance companies to use this device. So we start at the age of 5, but not every 5-year-old necessarily has enough thickness to the skull to have a very solid, what we call osseointegration of the Baha or BAHS implant into the skull. And so it could be 6, 7, 8, 9, it could be even later, but we just look at each individual child and make a decision when we see them. It is not necessary to have a CAT scan before doing the Baha surgery. Okay, from Katie and Chris, the first question, is canaloplasty atresia repair after Medpor or Supor surgery totally out of the question? We are leaning away from the canaloplasty part, but don't want it to be impossible if our daughter does decide she wants it someday. We aren't 100% positive yet and wondered what your thoughts were. So it is not totally out of the question. The way that the implant is wrapped with this flap, the blood supply has to be protected, but the blood supply in almost all cases comes from either right where the ear is, but more commonly right in front of the ear, right here. And the way the atresia repair or canaloplasty is done is through the incision in the back, which we already have made an incision there, and then they literally can flip the entire ear, implant, tissue, skin, all of it as a unit forward so they can do their drilling. And then at the end of their canaloplasty, they just bring the ear back. So it can definitely be done after. However, we would generally say to most patients, in theory, there's less risk to the ear. There's no risk to the ear if the canaloplasty is done first, but there is a smaller risk if it's done after. But in my practice, I haven't seen any problems doing it after. Their second question is, we would be traveling from New York. What is the average time families stay in California for, and how do pre-op and post-op checkups work? So we basically do ear surgeries on Tuesdays, Thursdays, and Fridays, and pre-op appointments on Mondays and Wednesdays. So if, for instance, you came on a Wednesday and you had your pre-op, your surgery would be Thursday or Friday, and you'd be seen the following 2 Wednesdays. So for United States patients that live in the United States, we would see you for about 2.5 weeks total time in California. International patients stay an additional 2 weeks after that, just to be sure everything's okay before they leave. Okay, this is from Denise. Hi Denise, if you're watching. So Denise is the mom of 2 beautiful girls who were adopted from China, both of whom had microtia, and both of whom I have already done a peer surgery on. So Abby loves to play with her reconstructed ear. She moves it forward and backward a lot, and it makes me nervous. I'm afraid she will break the implant or damage something inside. She says she likes the squishy sound it makes. Yikes. Should I encourage her to leave it alone, or do you think that it is harmless? These ears are tougher than we give them credit for. I actually think it's harmless. It's probably not great to play with it all the time, I will admit that, but she's not going to be able to do anything to hurt an ear. They cannot be pulled off or taken over in any sense, really damaged by just, moving them around or rubbing on it. So it's fine, but I understand why parents would say yikes, for instance. All right, this question is from Brooke, and she has a 3-part question. So, as a mom of an adorable 6-month-old bilateral Microtia kid, I'm interested in all the details that pertain especially to bilateral treatment. The first question, do parents have input in the design of the ear, such as the size and making it look like a sibling's ear? Since there are 2 ears to reconstruct, there isn't an ear to model from. So that's a great question, and absolutely parents have input. We have commonly looked at siblings or parents, like for a boy, dad's, or for a girl, mom's ears, and we draw that and we model the ear implant off of the parent or sibling. My general philosophy on bilateral patients is to make them of a very average size. I don't really want them on the larger size, and a little more, perhaps even a little more low profile than mine. Mine are not prominent, but they're there. So since you have 2 that you're being reconstructed, we would like them to be minimally noticeable, but that's not to say they won't stick out an average size. Their second question, how long do these ears last? Is it a lifetime, or is there ever a need to redo an ear aside from trauma? So similar to the last question that talked about the same topic, and we discussed that they've only been done since '91, so we really don't have longer than that experience. The product itself has been used, if not for ears, in other parts of the body for even 30 plus, maybe almost approaching 40 years now. So we do have extensive data on how long these last, but we can't say for sure that it's a lifetime. We're just not there in years yet. And in terms of redoing an ear, is there ever a need? I am sure there are rare instances where something happens. I mean, trauma, I guess, would be one, but something might happen that you need to redo an ear. For instance, if you developed, really thickened scar tissue for some reason, or it's usually most of the issues would occur within the first couple months after surgery, but I imagine there's a rare occasional case where you may have to do something later. The last question they asked is, what do the reconstructed ears feel like from the child's perspective? And that's a good question. And does it take them a long time to get used to them? Very interesting. So I will tell you that from a psychologic standpoint, which has to be considered in part when you're getting an ear reconstruction. So when you are very young, you really haven't been teased and you haven't been bullied and you haven't grown self-conscious necessarily. The acceptance of that ear when you're that young and kind of your brain is so malleable seems to be almost instantaneous. So I find that these little people, 3, 4, 5, even 6, really accept their ears and they don't complain so much. But I do think if you're older and as you get older, you might notice some of the physical things. So I'll tell you the things I've heard of. One would be that the ear's hard. The ears are hard. Like that is for essentially all ear reconstructions in order to combat what scar tissue wants to do, shrinking things down. the ear is rigid. It moves, but it doesn't ever bend like this. It just doesn't do that. So when you sleep on it, it could be that you may notice it feels hard. But then I get kids that say it doesn't hurt at all when they sleep on it. Other kids say, I don't like sleeping on it, I only sleep on the other ear. And bilaterals, you know, find something that works, whether it's a special pillow or a special position or always on one side. And then the other thing I think is fair to talk about, maybe it's more come up with adults or girls, is in the first 6 months to a year, the scalp loses its sensation and the ear's gaining sensation. So you're starting to feel your new ear, and then it takes some time for your nerves to grow in to give sensation to your scalp. So I think that sensitivity of numbness, and some people call it sensitivity, can occur. I remember somebody saying that when they brush their daughter's really thick hair, she's more sensitive having it brushed on this side than, say, the side that didn't have surgery. Reconstructed. That's about what I think. I mean, I think people get used to them, but yeah, there's differences. They're not exactly like the other ear. So then I'll ask Tiffany, who's helping me out today, if there's any other questions that came in that we should consider.
I don't think so, but I just wanted to thank everybody for joining. Like right now we have over 20 people who are watching this live, so that's really, really exciting. People are sharing it, and Lori's saying, hi Dr. Lewin, the new office looks great.
Oh, thank you.
Yeah.
Thank you.
Oh, here we go. Lori says, my 8-year-old did have some difficulty accepting the new ear at first. However, it's over a year later and he's happy and sleeps on it.
Oh, thank you. Well, that's really nice, helping me answer my last question.
And actually, we've posted about the Woomfy pillow before, and the manufacturer of the Woomfy pillow is coming to our office in a couple minutes.
That's right. We're gonna meet him,
So we'll be able to share about that.
We will.
Brooke says, thank you, Dr. Lewin. Hannah, Dr. Lewin is fabulous, with little heart and ear emoticon.
Wild that it's live.
Katie from New York, thanks so much for answering our questions. Raina McLeod says, Dylan says hi, he loves his ear.
Hi, Dylan.
Lauren Nano says, so good to see you. Owen is so excited right now.
Oh, hey, Owen. That's cute.
Well, fantastic. Well, this was really fun. If you guys have enjoyed this, please feel free to comment and tune in next time. Feel free to share this video. We will post it as well. Oh, here's another question, which you kind of addressed, but from Dana. My daughter has bilateral Microtia. How far apart can we have the 2 ears done?
Oh, good question. 3 months apart. You know, if you live in the U.S. and you're using insurance, it's very nice to try to plan bilateral surgeries to be done in the same calendar year. It's just advantageous from an insurance standpoint, so we like to do that for you if you can.
And then we have a comment from Miranda. We can't wait to meet you. My happy boy is very excited about 2 big ears.
Good. Well, this was fun. I kind of like that it's very casual. That's my style. And if patients like it and they think it's beneficial or educational, give us your suggestions, and maybe we'll have a topic of the day for this type of thing, so we can really help promote educating Microtia families about all their options. Thanks, you guys. Oh wait, I'm getting the one signal. Yes,
Dana says great. Casey Copeland says Sailor's loving her new big ear. Thank you, Dr. Lewin. You are amazing.
Oh.
Brooke says, at what age can a child get atresia repair, canaloplasty?
So depends on your surgeon. Some surgeons say 3 and up is okay, and other surgeons might say 5 or 6 and up. So talk to your docs that are experts in it. Please make sure there are people that do this surgery all the time, and you can go with your gut on that.
Diego says, thank you, doctor. Are you going to have more of these videos in the future?
Oh yeah, we are.
Erin Noble just says, hi, Dr. Lewin.
Erin, go support.
And thank you for being a sponsor of our Earicles conferences.
True. Support's been awesome, helping us out with our conferences, so we love them.
Want to give a shout out to my husband, Nate Wilkie, who tuned in.
Oh, thanks. I'm sorry I stole your wife from you for the last few days. I love her very much, but She doesn't want to move to California, so
funny.
she's coming back home to you soon.
So funny. Well, thank you.
All right. Thanks, everybody.
All right. Sounds good. Thank you. Goodbye.
Bye.